Hi, class. So today we're talking about HIV and AIDS, and that's primarily what we're talking about. I just wanted to go over a couple things. I have continued to enjoy reading um, your discussion boards. I think you guys are really, saying very great, thoughtful things, which I really appreciate. And I think what I'm gathering from what you're gathering too is just the need for sensitivity when reaching out to these clients about these different topics and trying to get to the bottom of things. I think the process of elimination is huge, right? So whether it be we're looking through if something is medical, then we need to address it. If it's something that's traumatic, then it needs to be addressed. If it's something to do with the relationship, then that needs to be addressed when we're talking about sexual dysfunction. Is it something to do with aging? So there's all these different factors. It's not as plain and simple, but most things in life aren't as plain and simple as they may seem. But it's especially when we're talking about sexual dysfunction and all those kinds of things, that process of elimination is really important and huge. So uh, I'm glad you are gathering that. And, we can't force clients to do things that they don't want to do. However, um, it's never a bad thing to see a doctor. And so we can encourage clients to see doctors. A lot of times they don't even take that into consideration that could be causing the problem. And so maybe it's just one person saying that to them that might make them think like, oh, is that a medical thing? I didn't know that. I think because people are so embarrassed, they don't talk to their doctors sometimes about those things, or they don't think they correlate. And so they just let things pass by and just ignore them when there could be a serious issue. And or because times were different many years ago, people didn't talk about menopause or aging or things of that nature, and so they don't know that like certain like dryness or things like that can happen to you as you age, which affects how you lubricate and which can affect like sex and it being painful. So there's things like that people just don't know, and you don't know what you don't know. And so just being able to educate, I think, and knowledge is power. That helps clients to get more information, to be able to make more um, choices and decisions. So great job picking up on that. Again, we don't have control over who comes into our office. And so making sure that we are being objective and making sure that we're asking great questions. And, we don't have to have all the answers, but that doesn't mean we can't find answers as best as we can, nor is it our job to answer things always for clients. Clients need to answer things for themselves. So I think you guys are picking up on that really well. Great job. Moving on to AIDS and HIV. I don't believe any longer you have the AIDS HIV class. That used to be a class we had to take. So we had a whole class on AIDS and HIV. Um, it's obviously a huge problem. There's a lot of great medical discoveries, a lot of great medications out there that are fairly accessible to people. You don't just have to be special to get them. However, we know with different insurances, there could probably be different costs for different people. And so there's a lot of technological advances, but there's not 100% cure for AIDS. And it can have a huge stigma with it because it's one of those diseases that is contracted by behavior potentially, not always by choice, but by behavior. And so, there was a lot of stigma with AIDS, especially in the 80s. People were very, very mean and discriminatory and associated it with being homosexual, which is not at all true. We know it doesn't matter if it's heterosexual or homosexual sex, it can happen. The transmission of fluids, it can happen from IV drug use. It can happen from blood transfusions. There was people back then that got sick from blood transfusions. I think there's Arthur Ashe was a famous tennis player. He got affected from HIV that way. Before they did, all the science they do with testing blood before they do transfusions. So there's a lot of different ways you could get it, but it was very much associated with the gay community, which created a huge stigma with the gay community. Um, Now we know more. So again, knowledge is power. We know how AIDS is transmitted and we know how it can be prevented. That doesn't mean 100% that it won't be. And so there still is a lot of privacy and confidentiality with clients that do have AIDS or HIV. So there are specific places for people to go to get help and to get services, mental health services. They're usually very, like I said, confidential. So like when they answer the phone, they don't say like, "Hi, we're the HIV support people," you know. It's more like on the DL down low. However, there is great things with groups that they're doing with people that are working with AIDS and HIV. The groups are great because you have people who are recently diagnosed, and then you also have people who um, have maybe had HIV for many years, and so they remember what it was like to be first diagnosed, and then they know what it's like to live with HIV and or AIDS. And so that can be a lot of encouragement to people, because people tend to get that diagnosis. It seems like a death sentence, um, and very overwhelming and scary, which totally understandable. It's a disease that you can't get rid of. So currently, so I get it. It would be very overwhelming to get that diagnosis, but the feeling of like your life's over, can never have relationships the same. People are afraid to touch you potentially because they don't know things. And so it can be very isolating. And usually people don't thrive in isolation, and nothing done alone for too long is usually too good. So that's where groups can be very cathartic, very helpful, give hope. That's why group work is great in general, and you'll have group class eventually, and there's a lot of great things that can come of group. But that's where a group for this population is really, I think, beneficial, because of um, all the things that a person experiences with that diagnosis, and not a lot of people can relate to that. Okay. Also, psychotherapy, huge, would be great. There's a lot to process, a lot of grief, grief of maybe how you wanted life to be, how life is. There could even be some um, regret or frustration with choices and or decisions that led to, unfortunately, the how one is contracted AIDS. And that can be very hard, whether it be a partner that you didn't know that had it, that then disclosed it later, things like of that nature. Um, those are things that can be discussed in therapy. I think as a therapist, it's knowing like you can't discriminate because somebody has a sickness that you don't necessarily like, I guess. Maybe you're fearful. And so educating yourself on like how does one contract AIDS, knowing your own level of safety, you're safe and you're fine. But be able to be like a level of support for your client is huge, especially when they might have been very isolated from their family members if they disagreed with something about their lifestyle, or they just don't understand, and in their lack of understanding, they're like shunning the person, whatever that may look like. We want to be able to be a support, come alongside, help them as they go through this process. When you're on heavy duty medication, like you would be for AIDS, it can be very overwhelming because there's a lot of side effects. That can be kind of upsetting and depressing depending on what the side effects are. A lot of factors, a lot of factors. So take into consideration these things when you're potentially working with this population, and maybe a population you really want to work with. For some of you, for others of you, maybe you're not against it. You just, if a client comes your way, a client comes your way. But there are specific agencies and things of that nature where you can do specific work with people with AIDS and or HIV. Great work, good things needed. I really do like the support groups. I've had a student in my class before that's the kind of facility she worked at, and it was just great, the things that she was saying, and just how the people felt so supported and not alone. And that's the thing, like most people want to feel understood, and they don't want to feel alone in situations. And you as a therapist have a huge role to be able to walk alongside people in their darkest hour and help them to feel like they're not alone. And that's a privilege that not many people get to have. And so to not take that lightly is really important, because it is a huge privilege to be let into someone's life in a very vulnerable moment, in a very dark place, and to be, the person that just comes alongside them. You're not solving the problems, but you're getting to hear about them. And for some people, they have nobody else to hear about them. And so that's where our compassion comes in, our empathy comes in. I don't take our role lightly as clinicians. I think it's very important. And especially as we're talking about, sexual dysfunction, sexual abuse, sexually transmitted disease, or infection now, they call them STIs. Even with STIs, there's STIs that don't go away, like herpes, things of that nature. It can be very traumatizing to someone when they find out they have that diagnosis and know now they have to tell a future partner. And what if people don't want to be with me because of that fact, because I have an STI? There's some grieving there and some shame, and that's not at all what our job is to do. Our job is not to shame anybody, but our job is to support and educate and, again, come alongside. Like, why do you feel like someone would want to be with you because of this? And walk that journey with them, because it's a lot to take in and it's a lot to adjust to. Because again, there's, for some of these conditions, there's no resolve. There might be ways to keep it at bay, but there's no going away. you know. Um, as far as AIDS, HIV, there's some great movies out there. If you haven't ever seen Philadelphia, great movie, talks about like legislature and kind of how that's come along with the AIDS community. Even the Freddie Mercury movie, I don't think they get into it a lot. It comes up, but even his story about how sick he got towards the end, and just how hard it was during that time to be kind of open about things and where you were at. Some of you might remember when Magic Johnson came out with HIV and what a big deal that was. And I mean, he's thrived for many years. Excuse me, I have a little tickle in my throat. He's thrived for many years with help with medications and medical advances and things of that nature. But that was like a really big deal, really, really big deal. So we've come a long way when it comes to acceptance and understanding, but there was a long road ahead until we kind of got to that place. And so there's some pretty tragic, sad stories as a result of how people treated others because they felt like they were going to contract something. So anyhow, I hope this information's helpful. We're moving right along. You have a paper soon due. So keep your head down, keep working hard. We're halfway through the semester, which is crazy. It goes by so fast in 8 weeks. So I wish you all the best. Have a good one.